Hello guys, if you have done RCT or you are planning to do RCT, watch this video. This is for you guys. Well, RCT in simple words. What is RCT? It is simply making your tooth or teeth dead from the core, okay? So we cut the supply of the nerves and blood. So when there is no neuronal supply, no blood supply, means our teeth will no more feel any kind of sensations. Whatever the wrong was happening inside the tooth, okay, that thing will be felt then, because there is no now blood supply in your bones. So slowly, gradually, with the passage of time, this particular tooth or teeth, they will start degrading themselves with the passage of time. For a long time, you will observe the color of the tooth changes and blah blah blah. Well, I'm not going that side. Coming to the point that is actually very critical, everyone must understand. And our body has got a very professional way. Whenever something is dead inside the body starts rejecting that thing, moving that thing out from the body, throwing that out from the body. So what the body then does is it starts doing the infection or generating the infection in the particular portion. So now it is about the tooth. So the portion where there is RCT done, so that particular portion will be infected then, and that infection will cause you several types of feelings of the inflammation or swelling of the particular portion where there is RCT done of the tooth, okay? So what happens next is that if unluckily this particular infection moves down the blood, okay, means it gets its way towards the blood, so then it is moving in the blood. Now at this stage, this infection and this infectious material that is present inside there, they will start moving to different body parts. And remember that, guys, a problem in the tooth will cause a problem in the other body parts. This is what they are linked together. Body parts are linked with the tooth, okay? So this infection will then travel and it may affect several other parts also. And we get a kind of question from all those guys, those who have done the fresh RCT. They say that we are okay, feeling okay. By fresh I mean 1, 2, 3, 4 years might be they have seen, and you're feeling okay then. So what does it mean? It doesn't mean that you are on the safe margin, guys. If you do not have problem, you're not experiencing problem, it means that your immunity is strong. If your immunity is strong enough, for lifelong you will stay healthy all the way long. But if you are immune compromised person, we have seen the cases that when the history of the patients were being observed in the history, we got it nailed it out that the particular person was affected by the procedure, that is RCT. And the same, there was a person who was suffering from the tinnitus. So after taking the history, we got this point that the person was having actually done RCT, and the person was actually suffering from the tinnitus since 2 years, and nobody could diagnose that particular patient. The reason was actually everything was fine, but in the history when we got the point that it was RCT, so then it was cracked that RCT is the cause of this particular problem of yours. So when RCT, that RCT particular portion of the teeth or tooth were there of RCT, when they were taken out from the body, from the mouth, so after a few days the patient started recovering. So what was that then? That was just because of the infection being processed time and again, and those infectious materials, they were moving to the inside the body and causing different problems in that body. Okay, the same was the case. Now it is actually having a quite large link with the breast cancer also. All those females, those who have got RCT in their history, when we got the RCT in the history of all those breast cancer patients, so it was again linked with that particular problem. So in short, RCT is actually not a safe procedure. If you get infected your tooth of severe type, the solution is take it out and just do another procedure that is actually suggested by the dentist, but not the RCT. Another point, that is mercury filling. If the dentist is doing the RCT and fills the tooth with the mercury, so that is not actually again recommended. Why? Because mercury is actually neurotoxic, and this starts releasing in the body with the passage of time, and it is damaging our neurons, okay? So that is from my side regarding the RCT.